Good afternoon, Alan Wundy here. We have just had a cabinet meeting here in the Western Cape, and very privileged to have the Minister Mkhize, the Health Minister, to join us. I'll hand over to him in a minute. It was really talking about our readiness as we deal with COVID-19, and of course we also have Minister Nonhlanhla Mbombo here. It's all about our readiness in the province, of course all of the work streams, but health being right at the centre and having to face the brunt. So welcome, Minister, and I hand over to you.
Thank you very much, Premier, and my colleague, Mr. Mbombo. We really want to say thank you to the government of the Western Cape. I've been visiting a number of provinces to just discuss the issues of what support they need and the level at which they're looking at the problem of the outbreak. Western Cape is one of the highest, being the second largest numbers of patients that have been identified. I have been given a briefing of all government response involving various departments, issues of basic sanitation, issues of dealing with the economic situation, dealing with the challenges of food and hunger and so on. I've been very happy to see that there's a whole comprehensive approach, which is an all-government approach to this matter, because this issue of this outbreak is not about health only. It's about all departments participating in the response. And it's also important for us to note that there are health issues, there are economic issues, there are social issues. There's a whole lot of issues that we must take into account. Secondly, we've been taken through a thorough briefing by the health team, and I must also say thank my colleague Mbombo for the very thorough briefing that has been given to me with the head of department and the various specialists in the department. They've been able to show me the accuracy with which they are following the unfolding outbreak, particularly looking at differentiating between those imported cases and those internal transmission. Geolocating them is where I was very happy that we actually can see exactly which townships, which towns, which suburbs are affected, which is for me the most important thing, because then out of that our response in terms of tracing the contacts is really where we need to be going. So I've seen that that's been done properly. They've also looked at the epidemiology of the disease, looking at the levels of admissions, and in fact there's clinical, there's now scientific evidence that in fact the transmission, local transmission, is beginning to be higher than what has been happening from the imported cases. This is exactly the point I've been making about the calm before the storm, that whatever limitations we're seeing now, it means that in the next few weeks we're actually going to be seeing an explosion that comes from our own internal transmission, where there may be no warning, where there might be very minimal symptom. That's why I do support the approach that the province is going to be spreading out now into testing, screening and testing out in the areas which are earmarked, because they've got cases that have been found and they've got contacts. And this means we're actually beginning to go onto the ground to discover, find and diagnose people who might be having the infection, which is a lot more better in allowing us to create a strategy to contain it. I'm also been briefed about the extent to which new beds are being created, and the capacity to do local triage where there will be testing, screening and testing, and also deciding whether people need to be admitted or need to be taken back home, and also the focus on quarantine. All of this together means that the province is on good, in a good cause, and I'm very happy and supportive of the strategy that they've taken. And I want to say the work that is being done is actually quite encouraging. It's important that they must continue in the way that they are doing it. So we want to thank the province for the work that they've done. We're going to keep working very closely so that we can ensure that all our systems are able to feed into one another. And at the end of the day, we must ensure that we have the best response. We want to look at a point where South Africa must be counted as amongst the countries that were able to fight and defeat the outbreak, and that we flatten the curve, and that we have, because of the dense populations, the migration, the overcrowded transport and inequalities, all of those issues must, and poverty level, mean that we must actually fight harder than any other nation, and we're determined to do that. And I'm also happy to say we're fighting this as South Africans. We're fighting this as one government. We're fighting this as all the citizens of this country united, whether a government or community, and that for us is the best solution of how we can actually look for a way to defeat this case. I want to say thank you to my colleagues, and of course at this point she's going to be able to indicate which way we're going to be moving out, just to have a sense of the activities on the ground. Thank you very much, colleague Ms. Mbongo.
Just to close off today, after this we are going to go to Khayelitsha, one of the sites and also one of the sub-districts in the metro. What we have done in terms of the community screening and testing, we will have a site each and every of the 8 sub-districts in the metro. And then also in addition, we'll have in the rural areas in the Drakensberg and also in the Mossel Bay based on the geo-mapping. So that's why this afternoon we're going to go to Khayelitsha, Mitchells Plain, Southern, Western, Tygerberg, and all of those. They will have the site. So this afternoon we're going to Khayelitsha just to show the Minister in terms of the preparedness starting on Monday. I just want to thank the Minister and the Premier. Thank you.